make sure to unmute your microphone when you're called on for that question. For those joining Zoom via the web, the raise the hand feature is going to be at the bottom of your screen. If anyone is joining us today over the Zoom phone line, you'll need to press *9 on your phone keypad to raise your hand anytime you wish to ask a question. Again, this is the media will be participating today. Once all outlets have had an opportunity to ask a question, we'll allow additional questions from reporters who have already presented an inquiry. We will be providing photos of the press conference via email after the conclusion of today's event. The video will be available on Access Humboldt's YouTube page and also available to download at Access Humboldt's archive at archive.org. One other note, the daily lab report that we send out, that may come out a little bit late today due to today's press conference, but that will be sent out as soon as possible. So thank you so much for joining us, and we're going to go ahead and get started with some statements from the doctor and from Sheriff Honsal.
Is that okay? All right. Just a couple things I was going to mention. It seems like we've been on a really long road with COVID, and it's hard to believe it's actually just been about 3 months since we actually started talking about it here in the United States. The community's response to COVID has taken a whole lot of effort and sacrifice on everyone's part, and I just wanted to say thank you to area residents for what they've done to protect the health of their community, especially those most vulnerable to serious infection. The shelter in place has worked. There's really no doubt about that. And I think implementing it as we did before we had large numbers of cases in our area really nearly stopped it in its tracks. But it's important to remember that the virus is still circulating here in low numbers, and it is circulating in other areas of the state and the country in higher numbers. The governor's announcement on Monday has opened the door to beginning a meaningful movement forward, and one that will allow us to customize the rate at which we proceed locally. And that is enormously important, but it's also a big responsibility that we're undertaking. We've talked about what the pandemic and a surge could look like here, and what it might look like if we do not move forward in terms of society, locally, our economy. Right now, there's no good roadmap that tells us what exactly will happen to our curves when we do something in between. So it's a time for optimism at being able to take steps forward to move our county into recovery, but it's also a time for caution and determination to stay the course. Although we don't yet have the governor's revised order in hand, I can say two things. In the order, we will, beginning basically tomorrow, it enables businesses who can serve customers with curbside or delivery services to open if they have appropriate safeguards in place for their employees and the public. And second, that the remainder of businesses that would be included under stage 2, and we don't have that list yet completely, are not all the same in terms of risk. And although we'll have the discretion to get these open under stage 2, if our numbers are looking good, all of these businesses will not open at the same time. It was not the intent of this to do so. So we'll be looking at lower risk and up a tier to more medium risk through stage 2, and we'll be opening those as we go and monitoring our progress over time. Thanks.
Thank you, Dr. Frankovich. I just also want to thank the citizens and folks of Humboldt County. I think we've done an outstanding job here. I think our businesses, our schools, churches, communities in general have all done a really, really good job rallying around the cause. And that was really to hit the pause button for life here, and to now we can't just simply hit the play button. We have to actually go in slow motion now in the next phase. And so I think it's really, really important to just reiterate what the doctor just said is we can't just simply go back to normal right now. There is a time, there is a speed that we have to go, and we have to do it in a cautious manner. And so that's what we're going to do here. And I'm proud of where we've been and the preparations that we've made as a county. We're able to really get to that next level, I think, a lot sooner than other counties because of our diligence here in the county. And we'll be able to talk about, the steps that we've made and through Public Health, Office of Emergency Services, dealing with California Department of Public Health in creating our alternate care site. We have our testing site here. We've expanded our contact tracing, all those things that are really, really fundamental in moving on into our next phase. And so I'm really, really happy about our teamwork and things that we've done here as a county. So as we progress, we want the county's patience and just wait for those guidance. The things that we're going to be working on in the next couple of days is when it comes to the business side of things, we have our soft opening tomorrow. And so there's some guidance on our website regarding our soft opening and things that we would like for you to have in place before you open, under those terms of the soft opening for certain retail. And then as well as preparing, if you're a business that could be open in the expanded phase 2, to prepare for that now. And so we have that guidance now that you can prepare. And so it's on our website. I do want to direct people to our website, which is humboldtgov.org. And I have it up on the screen behind me. And it's all the latest information there. But I also want to remind people that tabs at the top of the page. This is where you need to pay attention to if you're a business, because this tab is going to be expanding in the next couple of days to provide more information and more guidance about how you expand or how you get your business in compliance, per the governor's orders and per our county guidelines, so you can open your doors. So there will be a compliance component here. And so we really, really want people to be directed there, and all the information will be there, working with our economic development team, through the OES, through public health, and under the direction that the governor has laid out as far as our roadmap goes. It's going to be essential that you pay attention there and you prepare for that coming opening. And that's all I had. And then we want to open up to questions now.
Representing Redheaded Black Belt, he's going to be asking a question. Matt, you go ahead and unmute your mic and you can ask your question.
Thank you for taking my question, Sheriff Honsal. I am representing Redheaded Black Belt today. I wanted to ask, essentially, none of the surrounding counties we're aware of have instituted this 2-question per interview, roughly twice per week per media outlet. In light of the movement to phase 2 here, do you guys plan to return to answering questions in a way that more clearly supports the First Amendment right to free press?
Good question. I think as available as we possibly can be. The issue comes as far as availability. Dr. Frankovich and I both have lots of responsibilities that we have right now. We want to make ourselves available to the media to answer those questions. We cannot single-handedly meet with the media every day, all the media sources independently. And so this is that way for us to be as compliant as possible and to adhere to freedom of press and get that information out there, because we need your help in order to disseminating our message, and we need your help in asking the questions that the public are asking out there. So we want to be attentive there, and I think we've made ourselves available. Dr. Frankovich 3 times a week, myself 2 times a week, and I think you're seeing it now in this press conference. We understand that as things open up, we're going to do more of these type of things as a way that we can ask follow-up questions and talk about the issues that are in our community.
You have 2 more follow-up questions. Matt, go ahead.
Thank you. A simple question here, Sheriff Honsal. If Governor Newsom can hold press conferences multiple times a week, do you think a half-hour press conference once per day is unreasonable?
Again, there's a lot of different moving parts. We don't have all the resources the state has, and so we're a small county and with a lot of different responsibilities, and so we're doing our best. And so this is the plan we've laid out right now. And if we have more time to expand, then we will in the future. We're taking everything into consideration, but to compare the county with the state resource and what the governor does compared to what I do, completely different jobs.
Okay, one last question, Matt, if you have one.
This is a different topic rather than a follow-up. Given the recent statements by several Northern California county sheriffs, what is it about Humboldt County's geographical context, population, circumstances that led to your recent statements pushing back against Governor Newsom's beach closure directives?
So our beach closure directive from the state and how it was presented to us on last Wednesday night was an imminent closure, because of certain beaches that were violating the statewide shelter-in-place order. And those beaches were located approximately 700 miles south of us. And at that point in time, to have a statewide closure of all 840 miles of beaches seemed unreasonable to me. And when you make up some of these state rules and guidelines for public health purposes, they do have to be narrowly focused. And so I just wanted to, again, remind the governor that of that order has to be narrowly focused. And my concerns were for the liberties of our county residents. And at that point in time, we've done an excellent job adhering to our shelter-in-place order put forth by our public health officer. And they were allowed to go to the beach and some recreational areas because we have a lot of space where we can socially distance. We have a 4,000 square mile county. We have 135,000 residents. We have 110 miles of beach line, coastline. And so when you look at it, we didn't have the issues that were occurring in a certain small section of Orange County. And so at that point in time, I felt the need for the governor to know that I can't enforce a law that I don't believe is constitutionally sound for Humboldt County. Orange County may have something, but Humboldt County, I don't think, had that issue. And Sheriff Apperson had the same view, and so we were one of the few sheriffs that did stand up and say that order is not pertinent to our county. I believe the governor heard us. I believe the governor changed his mind and then was able to appropriately, just reference those Orange County beaches. And he's worked with those communities, and they're soon to be back online. And so I think it's something that did work. It was narrowly focused, and it took care of the problem. And then also our beaches here, our coastline in Humboldt County was, people can continue to go there, and it was protected.
I think in general, we've tried to be protective of the outdoor areas here in our county and our sparse population, and geography has allowed us to do that. I was also not in support of a beach closure in our area, and just, worked along our different channels to try and get that message up to the state. And I believe they heard the message and took that into consideration. So it worked out well for us.
Okay, now we have Ryan Burns with the Lost Coast Outpost joining us. Ryan, go ahead and unmute your mic when you're ready for your question and 2 follow-ups.
Okay, can you hear me?
Yeah.
Okay, thank you both for being available today. You've both been expressing optimism that Humboldt County will move quickly through this next phase in the governor's reopening plan. And Sheriff Honsal, I think you even said that you think dine-in service at local restaurants may resume in the next few weeks. Are you confident that the risk is worth the reward, and are you willing to accept responsibility if there's a big wave of infections or even deaths in the next month or so?
Well, from my perspective, I think we've been, you're right. We basically have to launch into this cautiously and just mindful of the possible repercussions. So it's important. I really liked the governor's framework in terms of preparedness, and it identified a lot of the areas that we've been working on locally as well. And so I think using those criteria that they are outlining, and we actually got details on those today, sort of what the metrics are going to be in those various areas of preparedness to be able to attest to our readiness to respond to COVID here and our ability to move forward through stage 2, perhaps more quickly than some areas, perhaps more slowly, just depending on how things unfold here. But to your question about safety, I think it's very important that we have the metrics in place to be able to monitor where we are in the pandemic, looking at our case counts, being able to do really robust testing so that we actually have an idea about how much COVID is in our community and how that's changing. And that's the idea of being able to follow that in real time will allow us to step back and slow things down if we're not ready, if we're seeing it change too quickly. So you're right, it has to be a balance of moving forward and trying to be as safe and protect health as we can.
Okay, I guess, my question stands is how much responsibility, because these decisions are in large part being left up to local officials, how much responsibility do you think the public should lay at your feet, I guess, if there is another wave of infections?
Well, I think it's basically a responsibility of our whole community. I think we can lay the groundwork and say when we're ready, as prepared as we're going to be to move forward. We can monitor the situation, but a lot of it is going to depend on not only the guidance that we provide, but how people are able to comply with that guidance, understanding the need to proceed with all of the safety measures in place that we have, and then complying if we actually do need to slow down or step back in our preparedness. So I think it falls on all of us to protect our community.
Yeah.
Okay,
I can answer that too, Ryan. It is something that weighs on me, and I know Dr. Frankovich. We understand
the gravity of the decision that we're making here. We understand that there's going to be people that do get sick once we start opening up. What we really do want the community to understand is take these steps seriously. We're opening up slowly for a reason, and whether you believe it or not, there are people that are either intimately caring for our vulnerable population or they are a part of it. And so those people are the ones that can be affected by some asymptomatic person that decides that they don't want to wear a mask and they want to go out in public. They don't want to use disinfectants and all these things we want to put in place. So whether you believe it or not, if you care for our community, I would urge you to please adhere to these steps right now as we start opening up, because again, how successful we are in this next phase will determine where we are in phase 3 and how far we can go into phase 2 and open up to different restaurants when there's restrictions in place. Now, there's going to be a different timeline here when it comes to the governor, and so the governor is going to allow certain things to happen in phase 2. And so we want to make sure that we put those as much restrictions as possible in place to allow businesses to open when they have those safety measures in place. But we understand, when there is a COVID death here in the county, it is going to, it's going to be upsetting. And if more people do get hospitalized, that's why we put these curbs in place and say, okay, enough is enough. We have to take a step back. So that's why we can't just simply hit the play button right now. We're going to take this in slow motion. How many frames per second? We don't know yet. We're going to go slower. And then as we start getting up to speed, then we'll speed this thing up to maybe a normal sometime in the future. But people have to realize that things are going to be moving at a slow pace, but we will be moving.
Ryan, I'm sorry too. This just to say, if your question is, do I personally feel responsible? Absolutely. It's a big responsibility, and it does weigh heavily. Absolutely. And it's the duty that we have to weigh all the evidence and to make the best science-based decision we can to move forward, and balancing what we know are the costs either way is huge. And I don't think, any of us working in public health especially have ever been in a situation quite like this. So it is not something you take lightly. Never.
Okay, thank you. Do I get one more follow-up? Is that right?
Yes, one more question.
Okay, so I also wanted to circle back to the the beach order, Sheriff Honsal. Last week, you received a lot of praise for saying that you'd refuse to enforce beach closure here in Humboldt County. The order didn't materialize, but I want to ask about your claim to being a constitutional protector. There's currently a number of quote unquote constitutional sheriffs across the country who are refusing to enforce coronavirus restrictions at all. What differentiates you from those sheriffs?
Well, I'm not sure about the reason why certain people take a constitutional stand in other parts of the state and the nation. But as far as us here locally, I believe in our public health officer. I believe in the directives that she's taken our county, and I believe that her order is compliant with the law and her duties as assigned as a public health officer for the county of Humboldt. And so at that, I have all the faith in her and her abilities to manage this. And so we are the law enforcement arm for public health. And so I just want to make that clear that I am not I'm not constitutionally standing against our public health officer or our local order. That was one thing that I stood up against, that I believe the state didn't have the constitutional authority to do so. And so as opposed to, not believing in what is in place, I do believe that this is what's best for our community. I do believe that its foundation is in the law, and it's for the betterment of our community, for public health and safety, which is really the spirit behind the health and safety code that backs up the health officer's order. So I do believe in the Constitution, and our public health order has that into consideration.
Next, we're going to move on to Taylor Elliott with Redwood News. Taylor, you can unmute your mic and go ahead and ask your question and 2 follow-ups, please.
Okay, can you hear me?
We cannot. Can you talk a little louder?
Can you hear me now?
Yes.
Okay. So the first question is directed more to Sheriff Honsal. It's just with businesses reopening tomorrow, and I know you guys have mentioned this business certification process and all of that, but will there be more of a law enforcement presence out there on the streets, making sure that people are in compliance and have all of these safety measures, in place to reopen?
So the question was that will we be out and about enforcing the public health officer's order and making sure that the soft opening of some retail businesses are adhering to the order? And our law enforcement will be out, but we're not the primary as far as enforcers for this at this time. There is a tip line for people to call, and the compliance tip line is 441-3022. 441-3022. So if people see that there's businesses that are not in compliance, they can feel free to call that number, and we will follow up with those businesses. If it's egregious enough that we'll send a law enforcement officer out, we will go out. We will issue warnings trying to get voluntary compliance. There were some businesses in Ferndale yesterday that did open up. One was turned out to be an essential business, and the other 3 did end up closing. And because they want to be in compliance with the law, and so I appreciate that, and appreciate the town of Ferndale for adhering to the public health officer's order. And so we'll be out. And again, we're on to stress education here. We want to stress safety, and that's the reasons why the recommendations we have in place that are on our website, will really be beneficial for people and businesses, to make sure that your employees are protected, that your customers are protected, and that you do have a plan for sanitation and safety of your business. So we will be out and about and trying to educate people and businesses to ensure that they're doing things right.
Okay. And then I actually only have 1 follow-up, just because someone else took my other question. But I know you kind of have mentioned it briefly, but if this phase 2 does go smoothly, are you guys able to give any sort of a timeline of when we could expect to move into that next phase locally? I know that the governor has his own parameters.
So in the stage 3, in the original statement that was made, I think on Monday, there was certainly talk about moving from stage 2 to 3. Along the way, we've talked about possible a regional approach to stage 3. I think because the state is allowing this sort of flexibility locally and we're all carefully watching what happens, I think stage 3 right now is just sort of on hold for everyone. So the idea being to look at the metrics as we go and see whether we're actually ready. For instance, if in our area we've moved through stage 2, things are going well and we feel ready to move to stage 3, that's the time we'll be discussing that with the state as well. And we'll see what's happening in other parts of the state to make sure that it aligns. But at this point, I'm planning to get us through stage 2 and then evaluating what's happening on the ground before we move into stage 3.
All right, that's all I have for you. Thank you.
Okay, so moving on, we're going to go to Andy Kraus with KRCR. Andy, we're getting you set up here. Go ahead and unmute your mic, Andy. You can ask one question and 2 follow-ups.
Hi, yes, this is actually Marissa Papanek. I am under Andy's guise today. Can you hear me?
Yes.
Hi, thank you, Dr. Frankovich and Sheriff Honsal for answering our questions today. First, I was wondering, right now, personal grooming businesses are obviously not under the phase 2 order for reopening, but we learned that the California State Board of Barbering and Cosmetology is threatening disciplinary action against any salons and barbershops that open for business in defiance of Governor Gavin Newsom's stay-at-home order. And you just kind of answered this, but I guess I'm wondering sort of specifically if businesses do opt to reopen early and go against the order, what is the consequence? Can they be cited? And what will that look like?
Yeah, so under the
it is essentially a fine, $50 to $1,000 that could be assessed per violation. So we could come back every day and assess that citation, and then it'll be up to the judge to determine what the penalty would be for that. And also, I think the bigger ramification is for those people that have a state license. So state licenses obviously are governed by the state, and so when you have let's say a liquor license or a cosmetology or barber certification from the state, you could be jeopardizing that if you open the doors outside of the state guidelines. And so that is something that would be difficult for I guess for you to get back. I'm not sure the appeal process for that, but that is something that could be jeopardized on the state level for that kind of certification.
And Marissa, one other thing I would add is that, I realize with your question too, our understanding is that those entities would be in stage 3. However, I do want to point out that, at this point, I really feel like the state's been receptive to the feedback that we're providing on the front lines here in our counties. And so I think that, when we're moving in through stage 2 and we're seeing what happens here, I think there is always a point at which we can reach out and ask for sort of reassessment of businesses or what might make sense at that time. So I would tell people to stay tuned because things are changing all the time.
Yeah, and
we understand too that
businesses can be innovative, and people are doing a lot of suggestions and a lot of problem solving regarding how they can put safety measures in place for the people that are performing their functions, whether it's hairdressing or doing nails. So we understand that, and so we we encourage people to keep going down that road of exploring and trying to modify their salons right now, because there will be a day that it will open up. And we believe that the state will provide some guidelines for salons to work under, because that is important. We do need haircuts, and we do need personal grooming and all those those things that are deemed, I guess, non-essential, but really are essential for our daily lives. So we understand that the state has been receptive to that, and so we are optimistic that there could be some changes in the future, but we'll keep preparing.
Okay, great, thank you. And to follow up on that, sort of a two-parter, the governor said that counties can be more restrictive than his orders. So is Humboldt planning to be any more restrictive or just sort of staying as loose as he lays out? And on that note, what will shopping kind of look like for these businesses that are doing curbside? Are we able to go into stores, and how's that going to look?
Just out of the gate, I would say that, right now I haven't been able to see the governor's order yet. So it's really hard to know. I would say going forward, it really depends, just as it's not necessarily a one size fits all across the state. And that goes both ways. So sometimes there may be things that we feel that are not really appropriate here yet. And so we'll have those discussions and figure that out as we go. Clearly, the intent of this initial sort of soft opening the governor talked about is that we are not having foot traffic in stores by customers. So the idea is the interior of these businesses be safe for employees, and that there's a safe method to be able to work with the customer when you do curbside or delivery service. But no, at this point, right at this very beginning stage, it is not meant to be inside shopping. And may I point out, it's also not meant to be sidewalk sales, that type of thing. It really is a purchase that is delivered to you on the sidewalk or at the curb.
Yeah, just think of drive-up coffee. What can you do through a drive-up Starbucks and those kind of things. So just as you drive by the door of your retail establishment, it's going to be that kind of exchange. Money for merchandise. So, and then that's it.
Okay, thank you. And finally, today in Humboldt, we saw a protest again. In Del Norte, we saw a protest. And so I'm just wondering in Humboldt, what you guys would say to people who are protesting and saying that the virus is gone, who might be looking at these loosening of orders as the virus being gone, and that they don't have to, follow these social distancing orders and health orders. So what's your message for those people?
Well, I would say, first of all, I would argue that point. We had another new case yesterday. We're just seeing low transmission, but not none. So we know the virus exists here. And while I appreciate the fact that people disagree on approaches, I think I would ask people who are protesting to consider the fact that aside from the community as a whole, there are many individuals in the community that are more vulnerable to serious infection, who that vulnerability may not be evident to them, as well as senior citizens, and that I think the masking and the other measures that we're requesting from people be respected because they help protect all of us.
Yeah, I do also want to remind people too that there was close to 100 deaths yesterday from COVID. So it is still out there. It may not be circulating widely in our community right now because of our shelter in place, but know that it's still out there and it's still circulating, and that people are still dying in California from this virus. So people can protest. That is their constitutional right, free speech. But we just ask too that they adhere to physical distancing and the masking, while they protest. And the message will get out, and understand people are frustrated because, they want to get back to normal, and we understand that, and we hope to get there real soon. We really do.
Thank you.
Next, we are going to have Sonia Worrich from the Time Standard. Sonia, you could go ahead and unmute your mic and ask your first question and your follow-ups. Whenever you're ready, Sonia. We can't hear you over here. We're still not able to hear you.
Okay.
One more time.
Okay. When did the county's models predict a surge to occur with the rolling back of the shelter-in-place measures, and how many confirmed cases, hospitalizations, ICU intakes, and deaths is the county expecting at that time?
Well, Sonia, I would say that again, we did some modeling based on where we were in terms of everything being in place as well as with nothing in place. There really isn't any good model right now for these intermediary measures that we take. And the reason is there isn't a great understanding of what, for instance, stage 2 means, how that specifically changes the slope of your curve. And that's why the ability to measure what's happening on the ground in terms of testing, for instance, as well as our ability to do contact tracing and investigations, all those pieces are so important because we don't know the shape of that curve yet. As we begin to move along this path, we'll be able to formulate some idea of what that's looking like and whether we need to slow or we're able to go more quickly. But right now, I can't make a prediction for you on what this next step is going to do to the curve. We just know it's going to change things. We don't know how much yet.
So what factors would trigger either a further rolling back or expansion of the shelter-in-place order?
So the kinds of things that we're looking for are, as I think you alluded to, we're looking at the number of cases. So the really good thing is we're getting a lot of testing done right now and getting some baseline idea of how much COVID is in our community. So what are some important things for us to look at going forward is how long does it take for those cases to start to increase? When we're starting to see cases, how long does it take for instance, the number of cases to double within the population? And watching that as an indicator of how the virus is acting is really important. We will be looking at hospitalizations, but certainly things like deaths in our community are a late indicator. And so we really want to be watching those initial things, like what percentage of our testing is coming back positive. Simple mathematical things like that can actually help us understand what's happening on the ground.
In the case of an outbreak, would there be enough medical providers to handle that kind of thing? And how would the county handle an outbreak among healthcare providers?
Sure. Well, I think one really good point is that even though we haven't had much activity and we're not a large urban area, we are a smaller area. And so a single large outbreak can impact us quite a bit, potentially. So what I can tell you is that our hospitals are prepared. One of the indicators that we need to be able to say we're ready to move forward is that we can handle a 35% increase in hospitalized cases, should that occur. And at this point, because we've been doing really well with this, we can easily meet that. Our hospitals have worked really hard on building their internal capacity for both general beds, ICU beds, as well as being able to move their staff about so that they can manage an influx of patients. But the really important thing is, as we're moving forward, is to figure out how monitor the growth of the virus in our community and be able to slow down or pull back so that we don't exceed capacity. And that's the art of this going forward and why we don't do it lightly and we don't do it all at once. And so it's again, we're sort of, as we've said, threading the needle on this and trying to be reasonable in our approach so that we can make sure we maintain adequate healthcare capacity for everyone who needs it.
Okay, thanks.
Welcome.
Okay, next we're going to have Thaddeus Greenson with the North Coast Journal. Thad, you can go ahead and turn your mic on and ask your 3 questions.
Yeah, thank you. And thank you guys for doing this today. So I wanted to follow up on the compliance question. Sheriff Honsal, you mentioned the situation yesterday in Ferndale where a handful of businesses opened in defiance and ultimately received cease and desist orders and closed. We've learned that one of those businesses reopened again today. So I'm just wondering if that's a situation where it would turn from education to enforcement, and you might consider citation to be in order.
It's my understanding that business is compliant with the existing order based on an essential business, and so the word I'm getting is that the only business that is opening there are essential businesses that previously were closed. Now they're opened up, but they are allowed to be open because they are deemed essential. And, okay,
Open today.
yeah, I'm just relying on.
I talked to the chief of
And
police.
so, so however that bookstore is, is becoming compliant, then I'll follow up with that.
Well, I mean, I guess more generally then as a hypothetical, I mean, if a business is counseled that you are out of compliance and you need to close, and they close and then make the choice to operate again, to open again, it seems like it's not an education issue at that point. It's a compliance issue. And so how would you handle that at that point?
Yeah, absolutely. So what we do, and I've talked to the chief about this too there, and other chiefs, that when someone's openly defiant, that citations will be issued. And so no one's necessarily going to jail for operating a business, but these people can be cited every day. And then these, and again, $50 to $1,000 fines. It all depends on what the judge ends up doing with it. But essentially, these people that operate in these businesses can be cited daily for it, and so that will happen. That was the strategy that was going to happen if these businesses did not close, that they would be cited.
And then I guess more broadly for both of you guys, do you think that, or have you gotten any indication from the state that, compliance with existing orders, whether it be businesses or average residents, is something that the state will take into account when deciding whether to cede more control to local jurisdictions?
In fact, I think aside from the issue even that of the, whether the local businesses are complying, I think it's also a question of whether, for instance, we are meeting the parameters that we need to have in place as we move forward to continue moving across the stage. So I think, there's that potential for disagreement between the reading on the ground and making sure that, we're having ongoing conversations with the state about where we feel our readiness is and what things are looking like in terms of our safety of the community. And then when we feel we're ready to move forward, if there are communities who are moving forward more quickly than that before they've met those parameters, I think the state has indicated there's potential for them to step in and, have conversations with those areas.
Then my last question is, on Monday, the governor indicated that that there would be this certification process for local jurisdictions to go through to kind of proclaim readiness, and said that details about that would be trickling down to counties. Has that happened yet? And if so, what does that criteria look like?
So we actually just got that today, and around lunchtime, I think it was. So I can walk through that quickly for you. The indicators, the criteria that they have listed for readiness are, one, that there's an epidemiologic stability of COVID-19 in the community, and by that they mean that there's been less than one case per 10,000 population in the last 14 days, and that we've had no COVID deaths in the last 14 days. So that's one criteria. The second is that there are protections in place for our essential business workers, our critical infrastructure workers. And so for things like our first responders and healthcare workers and all of those entities, so as well as other essential entities. So there's guidance for employers and resources pertaining to the safety of those workers and the structure of their environment to enhance safety, as well as having appropriate supplies, disinfectant, appropriate gear to be safe in that category. So that's number two. Third is testing capacity. We need to be able to test a minimum of 1.5 people per 1,000 residents. At minimum, we need to have that volume. And we actually do need to report on our average testing daily for the last 7 days as part of this attestation. And then if we aren't testing at that level, they want sort of a description of why we feel that that's not necessary. For instance, in very low incidence areas or smaller access areas, they may feel confident that the amount of testing they're doing is adequate for the situation. And so you have the ability to talk about that. They also want to make sure that there's testing availability for 75% of a county's residents within 60 minutes for a rural area, within 30 minutes for a more urban area. The fourth is containment capacity. So that speaks to the issue of having sufficient contact tracing. And they mentioned specifically 15 per 100,000 population. We have 15 staff who are trained and available per 100,000 population. And then that we actually have available shelter for percentage of our homeless population who are experiencing COVID infection, so that we can appropriately isolate and quarantine individuals who may be homeless. The fifth criteria is hospital capacity. Again, as I mentioned, can we accommodate a 35% surge in activity above what we would normally have baseline in hospital activity at this time of year? And do we have adequate PPE? The sixth are that we have adequate PPE in places like skilled nursing facilities that support some of our most vulnerable populations. The seventh is really not so much a criteria as that they want to see plans for moving through stage 2 and a proposed timeline for moving through stage 2, as well as how we identify when we need to slow or stop our progress forward. So those are the indicators that they listed today to sort of be able to attest to the state and then move forward if we're meeting all those indicators.
Okay.
Excellent.
So we've reached all the people that had their hands raised, so we're going to go ahead and go on to the second round. So just as a reminder for reporters, you can go ahead, if you've already asked questions, go ahead and raise your hand again, and we'll get to you as we get through each reporter. So next, we're going to have Sonia Warrich again from the Time Standard, who has raised her hand. So we're going to go ahead and go on to her. Sonia, you can unmute your mic, and you'll have another question and 2 follow-ups.
Okay. How many contact tracers does the county have? How many is it expecting to need? And is it expecting to need to hire more?
So we clearly meet the state requirement right now with the number we have. We've increased our team essentially to about 30 people, which includes seven teams of basically a team lead plus the contact tracers that work under them. And we're sort of have a model of 7 teams of 3, 7 teams with 3 people under the lead, as well as the structure above that, because a lot of these cases are not just a matter of identifying an individual and then informing them that they need to isolate and, asking some of those follow-up questions about their contacts, but it's also some nuance about who's a close contact, who's not a close contact, and evaluating how far out that investigation needs to go. So that's where we are right now. We're actually building that capacity. I'd like to see our capacity doubled on that. And so we're moving along to do that. One really important resource we have is we've become part of a pilot project with the state for a training platform that's been developed. And we have people participating in that right now. It started, registration was last night. We have some folks starting today. And we are reaching out to individuals in our community as well as our internal staff to round out the people in that team that need to have some clinical expertise, as well as then focusing on individuals we can pull in underneath them. So I expect to have that doubled, but we meet criteria where we are right now.
Okay, and in terms of information about the coronavirus, new information is coming out all the time. So how is the county working with hospitals and healthcare providers to stay on top of the new symptoms that are emerging and appropriate treatments?
Sure. So I think our healthcare providers, both Dr. Ennis and I are speaking with them quite a bit. And we do provider alerts. We sent out 2, I believe, this week, talking about some of the changing testing priorities, as well as sort of where providers should be sending patients for which type of symptoms, where testing sites are appropriate. The other piece of that we've been talking with our provider community about is the expansion of their services. As people know, a lot of the hospital-based and outpatient-based services were ratcheted down in preparation for COVID. We feel that this period where we've had low activity is a really ideal time for people to go in and see providers, go in and have some procedures done that are important to their long-term health, and may be more difficult to access when we reach a period where there's more COVID activity. So that's also been part of our ongoing conversations. And also, we provide information to our providers about testing resources. For instance, what is the guidance now for provider communities about serology testing, the antibody testing? What makes sense right now? And sort of helping to consolidate some of the information and provide guidance, because it takes a while to wade through everything. And busy providers, this is just something that can be helpful to them. So I think the main piece is communication, and we send out a fair bit of that, as well as talking to them directly.
And is the county working with child care providers to be able to help parents get back to work?
Childcare is a really important issue, you're right, especially as we try and get people back into the workplace. So, of course, under our current order, childcare was permissible and prioritized for essential workers, really. And so there are recommendations and sort of rules in place about that, looking at groups of 12 or less for childcare, having a stable cohort of children as well as providers for those children so that they're not moving and mixing those groups, and then a bunch of other recommendations. So we talk to childcare entities as they have questions and provide guidance. I've been talking to groups that provide, for instance, some outdoor childcare opportunities in the summer and what that can look like. And of course, as we bring our workforce back, that's not all just, as we referred to it, essential workers, we need to be able to have childcare accessible for those folks as well. So yes, we're providing that guidance. I think more will be coming out on that as well.
Okay, we're going to go on to the next reporter now. Our next reporter is Matt Lefevre with Redheaded Black Belt. Matt, you can ask one question, 2 follow-ups again. Please unmute your mic.
Thank you for taking my questions here. These are directed at Sheriff Honsal. I'm interested in how the statements regarding public beaches kind of started to touch on the importance of local control and local determination of the appropriate protocols to deal with the pandemic. And, as a sheriff, your role is to determine what is justifiable and reasonable to enforce in your county. So I'd like you to address the question, what have you deemed, other than the beach protocols, as unreasonable and unjustifiable in terms of statewide pandemic protocols that you would enforce here in Humboldt County?
So as far as the enforcement of Humboldt County, what we're looking at is we're closely aligned with the state as far as our shelter-in-place order. We can become more restrictive, like the governor actually pointed out, and we recognize that. But our order is really in line with the state shelter-in-place order. One of the statements that we've made, is in which the governor has heard loud and clear is our ability to have those local control, those mechanisms for local control here. And he's laid that groundwork. And these variances that Dr. Frankovich has talked about today with CDPH, and you meet these guidelines, that you should be able to expand your phase 2. And so I'm very, very appreciative of that. And I think a lot of our residents are, because we're in a different position than maybe a larger jurisdiction south of us. And so we have the capacity, we have the testing capability, we have some of those things in place, so we can, go to the expanded phase 2 quicker. And so that control has gone back to local. But as far as other state, law that we've that he's put in place, it's in line with what we have here.
Thank you for that, Sheriff Honsal. Sort of related, and to me, the local control, the statewide mandates can maybe be informed by other populations around the state and then sort of be a one-size-fits-all mandate. I'm wondering, how do you see the statewide pandemic response reflecting the California urban and rural population divide, culturally, infrastructurally? Could you speak to that?
Yeah, number one, I think the governor did an outstanding job getting out in front of this early, seeing this shelter in place as a way to to really answer this pandemic from the very beginning, is that we need to stop. We need to stop our movement. We need to stop how we do life because of the rapid spread of the coronavirus. And so that was a bold leadership move. And so, and when we, did that here too, and then the next day the governor did the statewide order. So it was a bold move throughout the state, and I think it helped save lives that way. And so, but then we shouldn't have necessarily, after that point, we had to, again, put things into place to make sure that we were prepared for eventually opening up. So we understood, like I said, moving on beyond that to make sure that we were ready to go when we had to open things back up. And so I think it's something that, as far as local control, I think we're in a place now where we can theoretically, determine our destiny based upon our compliance with our community. But we do see places like MODOC, where they have 9,000 population, where they said, we want to go quicker than the state, and we believe that we have that ability based upon, our zero count, and then the ability that we put these travel restrictions in place, and we can open schools, we can open these things up quicker than other parts of the state. And they made a decision based upon what they felt was best for the county. If I was in their county, I would consider that as well, but we're not MODOC County, we're Humboldt County. We do have coronavirus in our community, and we have to protect our community from the potential spread of this virus.
I would also say that, I appreciate regional differences, and obviously, even at this point, the infections have played out differently in, for instance, the Bay Area compared to here. I think part of that is because the Bay Area already was seeing a fair bit of activity when things got shut down. Not anything like, obviously, what I think it was early enough that we didn't see what played out in New York, for example. I think when we closed up here, we did it really right before we were even seeing that level of activity. And I think that really helped us put everything kind of in a stall pattern here. And again, I really do think that the movement by the governor and the counties across the state actually protected people greatly. But what I would also say is that as much as I'm looking forward to this ability to customize based on our local picture and readiness, I do appreciate the fact that to some extent we are only as healthy as the counties next to us. And I think it's important that we're looking at those counties, seeing how they're doing, because an outbreak that is, next door can easily become our issue as well. And we all know that as this opens up, at some point travel is going to open up, and that's going to impact small communities greatly who don't have a lot of circulating virus. So I think it's important that we're attuned to what everybody's doing, and there is some merit to looking at what things are important to do together and what things we can do independently.
Well, I appreciate your perspectives on that. And this last question is touching upon Humboldt County jail intake protocols. Essentially, we've seen a number of people arrested that were let loose or never jailed because of concerns about COVID. And now that visitation's set to reopen as we're entering phase 2, does this mean that criteria to hold inmates is going to be returning to the former levels?
No, it is not. Not at this time. We do have a quarantine protocol that we have in our jail facility, and we only have a limited number of cells that we can quarantine incoming inmates. We still are processing people. We are holding people that have committed serious and violent offenses, and then also repeat offenses. So if someone is breaking into cars repeatedly, it's becoming a public nuisance, we can hold those people until their arraignment. And so we have worked that out with local law enforcement that, if there are those people that are likely to reoffend, that they will spend that time in jail and until they see a judge, and then at that time the judge can order them released or continue to be in jail.
Thank you for taking my.
Thank you, sir.
Okay, we're going to go on to Ryan Burns with the Lost Coast Outpost. Ryan, you can unmute your mic, and you have one question and 2 follow-ups. So go ahead, Ryan. You're still muted.
Can't hear you.
Oh, there you go.
You got
Go
me?
ahead.
Gotcha.
Okay, great. So I heard earlier, I think it was on NPR, they interviewed a health official who said that it's safe to assume that in any community, the actual number of infections is 30 to 40 times the official count. Dr. Frankovich, does that sound like a reasonable assumption for Humboldt County?
Yeah.
What I would say is I've seen those numbers too, and actually I've seen pretty broad range of predictions on that. And I think, it's a really good point because it's a concern, right? Is that part of understanding how much you actually have is how much testing you can do. And I think we can all agree that in general, testing has been really woefully inadequate across many areas of the country. So I think as people start to have the capacity to test, and certainly as our local capacity is increased, I think we're going to actually understand what that number is, rather than just having a guess at it. And but it would not surprise me at all if we have more COVID than we think. Right now, the testing numbers would suggest it's pretty low, but again, it'll be ongoing monitoring to figure that out. I think it might be lower than those predictions in some other areas, simply because we're rural and we've been closed down.
So you've mentioned that in order to get the green lights for moving through these phases of reopening, you need to maintain a certain percentage of testing, percentage of our population. If that starts to drop off, do you have plans for proactively recruiting people to be tested? Might you include it or urge clinics to include it in their routine checkups like you might do with a flu shot?
Well, I would say so far we're looking pretty good. With the general public being able to access the testing as of Wednesday, I believe the roster we had today, I think, was full. And again, I think so far this week we've tested over 300 people already. But you're right, over time that could drop off. Obviously there's no recommendation to, sort of force people to come in and be tested. But I think our routine screening of some of our high risk individuals is an important thing for us to do ongoing. So, doing that ongoing testing of, say, healthcare workers and first responders at some kind of regular interval will give us a lot of information. And I think that, certainly as we move forward and we start to see some transmission within the community, there will naturally be more testing. So I think the important number is what is our capacity to test as opposed to what is our daily testing. Right now, I really want that daily testing to know where we are baseline.
Great. That's all I have for you. Thanks again for taking the time today. Appreciate it.
Thanks, Ryan.
Okay, next we are going to go to Marissa at North Coast News. We're getting her put on here, and Marissa, you can go ahead, unmute your mic, and you have 3 questions.
Yes, thank you. So first of all, speaking of testing, we haven't really seen the numbers of daily tests go up all that much, but with the new community testing site, when are we going to see, do you think those numbers really go up? And how many people have signed up for tests so far? If you know that.
Well, I would say just since last Monday in the Optum test site that we have going, I don't know what our number is today yet, but again, we've tested over 600 people just since last Monday. So, that's augmented our testing enormously, and that's been great to see. Internally, of course, we're still testing, and on most days, we're kind of in that, 50 people day. There are some days where we've actually been able to really bust it and get, 70 or so. And if we actually do some mass screening and have all the specimens lined up in a row, there's an occasional day we can even exceed that because the specimens are all ready to start first thing in the morning. But So I actually think, again, we'll meet that 1.5 per 1,000 that we have as our target from the state, but part of their recommendation is that we are aiming for 2 per 1,000. And so that's where we're going next, is working on further increasing our capacity. And I was in conversations with the people running the Optum site at the sort of the corporate level today, as well as our state testing task force to talk about how we can do even more on that front.
Can I just plug that site that people can register? People can go online to make an appointment for our for testing, and that's lhi.care/COVID testing. And then there's also an 800 number, 888 number, 888-634-1123. This is also on our website, and people can again access that, make an appointment, and for a specific time and get tested. I got tested this week. It is a really quick and easy process, somewhat uncomfortable, but it isn't as bad as you would think. So it is not bad. And within 48 hours, we got our test results, and so it isn't bad. And I encourage the community to take advantage of it. If you are asymptomatic or mild symptoms, you can make that appointment. If you are symptomatic, you have the symptoms, please call your doctor.
And one thing I would mention is that right now the specimens are collected. The one the sheriff referenced is called a nasopharyngeal swab. So that one is a little more aggressive swab. What we're working on with the test site as well is down the road, I think we may be able to actually move towards using just a swab that's in the front part of your nose and is even quicker and easier to do. So we'll keep people posted on that. But yeah, I really encourage, if you're moderately ill, that you contact your provider, or if you're someone who's high risk either by your profession or by your health status or age, that you talk to your provider about testing if you actually have symptoms. But if you're mildly symptomatic, not at any particular increased risk, or you have no symptoms and would like to be tested, we're happy to test everyone.
Okay, thank you. And on that note, we found out yesterday that United Indian Health Services has access to antibody testing now. Is the county planning on utilizing this at all and partnering with them, or utilizing this type of blood test?
What I would tell you is that that's the serology that I was kind of referencing earlier, the antibody testing. So the idea is to do a blood test that tells you if, or may tell you if you've been exposed to COVID virus previously. What I would tell you about that testing right now is that it is very useful from a public health surveillance standpoint. However, it isn't particularly useful on the individual level right now. And the reason for that is that if you test positive on the antibody test, it suggests, if it's a good quality test, it suggests that you have been exposed to the COVID virus, but it doesn't tell you if you actually have immunity to the virus, or if you do have immunity, how long that is going to last. So right now, we don't have enough information to be able to tell you how to meaningfully manage your health based on those results. I hope that we're going to have that information soon. There's a lot of research going on about that, but right now it really is most useful as a public health surveillance tool.
Got it. Thank you. And then my last question, I guess, is people want to know when they are able to go dine in restaurants again with all of the measures that are in place. Will they be able to go with their friends, or will it be restricted to just the people that you're sheltering at home with?
Good question. I think part of it will depend where we are as we open those up, because you're right, it goes to group size in addition to just the issue of being out, right? So, it's an easy reach to say being out with your family, to go out to eat, and what a restaurant might look like, maybe something like, again, decreased capacity in the restaurant so that you're able to spread tables out, or dining outside where you're able to do that more easily. Perhaps there will be, you can't mask for your meal, but your wait person can mask. Using perhaps disposable menus, doing frequent cleaning. These measures, I think, will be outlined next week from the state. But obviously what we look forward to is the ability to go out with, a small group of individuals to eat. And so I'm hoping that when we do open them, that's going to be the possibility right out of the gate. But we'll see. At this point, I would take being able to go out, no matter who I was with.
Absolutely. Thank you.
Mm-hmm.
Okay, next we're going to go to Thaddeus Greenson with the North Coast Journal. Thad, you can go ahead and unmute your mic, and you've got 3 questions.
All right, thank you. So just following up on the state criteria, how do you both feel we are, how we measure up to all those components the state is going to be looking for?
So
Sure.
I'm just walking through them, Thad. I think, on the epidemiology, we're good in terms of our case counts, and we've had no COVID-related deaths. On stage 2, the protection for critical infrastructure workers, I think the organizations for those workers have been really working hard in general to have good guidances in place, and we've consulted with those folks as well on those. I think they have adequate supplies and gear, so I think we're pretty good there. Our testing capacity we can meet, both in terms of the geography and having people close enough to be tested, I think, as well as the test capacity. We've hit it with our containment in terms of contact tracing. And I think we want to look at make sure that our number of beds available for our homeless population in case of an outbreak are adequate. So we're looking at that, but we certainly have that whole program in place, and it's working very well. Hospital capacity, we're there, but we do want to ensure and put in place a measure so that we know that PPE is adequate for at least 14 days. I'd prefer even 30 days going out so that we know if there is an increase in cases, we can manage it. Our skilled nursing facilities do have PPE, but I want to again make sure that they really have a good supply and that they're linked with both good commercial supplies as their primary source as well as the supplies that we can help them access. I also do want to make sure that those facilities are really well prepared with policies and procedures in place that make it a safe environment, because ultimately most healthcare entities will experience COVID in their facility, and they're going to need to be able to isolate, quarantine, protect staff and residents in those congregate settings. So we want to make sure that happens and is all set to go. So I think in general, we're actually in really good shape on the local level for this. At this point, I envision us pulling together a lot of the documentation pieces that will be required to submit and attest to the state, but I think we're actually in really good shape. It's taken a lot of work on the part of public health, the EOC folks, and our hospital partners and others to kind of make that happen.
Just to follow up on the testing component, my quick math says that's about the threshold of about 200 tests a day or target for Humboldt County. Do you anticipate us consistently meeting that, or kind of asking for a waiver as you explained earlier?
I don't envision us right now testing 200 people a day. And that's where I think us being able to express to the state that, we can put together that capacity. We can certainly meet, when we look at this, we can meet about 200. It puts a bigger demand on our lab internally, but if we combine our internal lab, our Optum site, as well as some point of care testing that's done and the availability of commercial labs, we can meet that. But to be honest, what I want to count in our testing ability are all those tests that we can get results on in good time, because that's what we're going to need when we're identifying contacts and tracing them. So I want to increase our capacity further. And the way we can do that is accessing some supplies for our own lab that would allow us to operate our Gene Expert machine at a capacity that would allow up to 160 tests per day. And then the other way is to increase our ability to serve bigger numbers through our Optum site when that becomes needed.
And then my last question for you guys today is unrelated, but there's been a lot of talk about stores opening, restaurants reopening, and I was kind of struck by a comment Dr. Frankovich made at yesterday's availability of normal for me would just be having a friend over for dinner. Any idea when that might be? We might have be able to have a couple people from outside of our homes visit for a meeting.
It sounds really good, doesn't it? I mean, again, the issue really is that sort of gathering size, right? And that ability to mix. And certainly as we start to move about in the community for things that are not just essential needs, there's going to be some element of that happening regardless, obviously masked in a distance. So what I'm really looking for and hoping to see in some of the documentation coming out from the state in the next week is whether we're going to be able to reasonably talk about gathering sizes. And particularly, as you mentioned, that gathering outside our home unit and what kind of parameters we want to put in place for that. So yes, I'd like to make that happen sooner rather than later in a reasonable way.
So thank you guys.
Okay, so we only have a few more minutes left. If the panelists, if you guys would like to say any closing statements, now would be the time.
I think we covered most everything and that we had hoped to today. Again, I just want to remind people that this period of time, I expect we are going to be opening things fairly quickly here. That's my expectation based on our ability to meet those parameters that the governor has set forth. And again, I think it's going to be incredibly important for us to do this in a smart way. So I really am asking for people to, I know it's been a while and people are really eager to move forward, but I want people to understand that it is incredibly important to the safety of the entire community that we really do this in a thoughtful way. And we have every intention of balancing those risks and moving forward as quickly as we can to meet those needs. And as eager as a lot of people are to move forward, I want everyone to recognize that there are also a lot of people in the community who have concerns about opening up, and that and they want to know that we're taking safety into account when we do so. So I'm asking for everybody to really help out as we do this, and that we'll try and accommodate your needs as quickly as we can. It's going to be an ongoing balance of health and economic recovery, as well as our recovery of our normal lives. And it's just going to take all of us to do it together.
Thanks, Dr. Frankovich, and your leadership in this whole time. And I appreciate this community's patience. And, information here is key. And so we want to make sure that everyone stays updated on the latest information. If you're not following our social media or following our Humboldt Health Alert, please look at our website daily. That's where you're going to get all the latest information from the COVID, especially if you are looking for testing, looking for guidance, where we're going with phase 2. That's going to be the source of the information. And also, if you have just general questions about anything, you can call 441-5000. We'll be able to at least try to answer your question or steer you to the right direction. And it's very, very important that in this time where there's a lot of maybe misinformation, a lot of fear, a lot of anxiety of what to do next, we want you to get the latest information so you do feel comfortable with whatever decision that you make in this next moment. So I want to thank this community and thank you for everything. Our cities, our counties, county departments have done a phenomenal job, and so we're going to get through this together. Thank you.
Thanks.